Through prayer, we're able to find relief for anxiety and receive the peace of God. Jesus gives voice to our depression when he said, "Come to me, all who are weary and burdened, and I will give you rest." And now, here's Rev Sue.
Soul, God is in control. I got Satan on my trail, but I'm singing all is well. He's attacking every day, but I'm watching while I pray. No matter the attack, I won't turn back.
Good evening, and thank you for joining Sunday Evening with Rev Sue. Our guest today is Reverend Stacy Smith. And I am happy that she really took some time to be with us this evening, because I know her schedule and she's a very busy person, and she has so much knowledge of what we're going to talk about. But let me tell you a little bit about her. She is Reverend Stacy Smith, and she is, I would put this way, she's some of everything that you can think of that captivate your mind. She is the daughter of Lenny, we call her Lenny, Mrs. Lenny Wilson, and the late Reverend Dr. James Wilson. She has a great husband and two sons. What I like about her is because she has taken just many years to focus on mental health problems in the United States. And she is a part of the National Alliance on Mental Illness. But another thing is that she's bold with it. She has a full desire to help people. And I've been knowing her for a while, and we hope that as we listen to her this evening, that we will come out of this session and know what mental health is, how we can get assistance, and what our community, our churches can do to help one another, so that we as a people will not be afraid or ashamed to admit the issue that we do have, that we carry every single day. So Reverend Stacy Smith, we thank you for joining us today, and may God continue to bless you in all the work that you're doing. I know that you and your family are hardcore Christians, that you're a member of the First Baptist Church of Glenardy, and as a community health educator and certified in healthcare first aid, as well as a mental health instructor. So that's why we're excited today, because we have an expert here to talk about mental health. So welcome with us this evening.
Thank you so much, Reverend Sue, for asking me to be here. As I often tell people, I didn't think that mental health was going to be my calling. In fact, I did not volunteer for it. But when it impacted my family, I realized that I was being called to this very important topic, because a lot of people, especially in the faith community, do not understand what mental illness is. Mm-hmm. And so I think I would love to just share how mental health and mental illness are not the same.
Thank you. Please do that, because most people think mental health, mental illness, the same. So right. Please do.
Absolutely. So mental health, I like to say it involves effective mental health, involves effective functioning in our daily activities. And the results produce something positive, typically, unless there is something wrong with our health. Just like in our physical health, when we are physically fit, we usually can produce positive results. But when we are physically ill, it's usually the reverse. And so mental health involves effective functioning in our day-to-day life. But mental illness involves patterns of thinking or behavior that cause a person significant emotional pain or prevents normal daily functioning. That's a simple definition. Now, I'd like to share with you what the CDC says. The CDC says that mental illness is a medical condition that disrupts a person's thinking, feeling, mood, ability to relate to others, and daily functioning. There is no single cause for mental illness, and we can talk about that more. And a number of factors can contribute to the risk for mental illness. And I know we're going to talk about that as well. But I want to point out that it is diagnosed by a trained professional. So if somebody says that they're depressed, that doesn't necessarily mean that they have a diagnosis for depression. And a lot of times we mix our terms: mental health, mental illness, depression, etc.
Mental health, mental illness, and depression.
And depression.
Not the same.
Not the same.
Not the same. I was, Rev Smith, I was reading a while back that there were nearly 10 million Americans are living with serious mental disorders. 10 million.
Yeah, so I think it all depends on where you are, but that is definitely true. There is one statistic, I think, that stated it was more than 5 million worldwide, especially during the pandemic. In the first year of the COVID pandemic, the global prevalence of anxiety and depression increased by a massive 25%. That was according to the World Health Organization, an increase during COVID.
And that goes back to isolation. Sometimes people are isolated.
Yes, definitely goes back to the isolation. Someone who has a diagnosed mental illness, depending on the type of mental illness, isolation can be, and I use this next term loosely, death. It can be very damaging to someone with mental illness because they need community, they need connection. But other factors during COVID, what happened is there were multiple stress factors, whether it involved family members who were getting sick and suffering, fear of infections, loss of actual loved ones, grief after bereavement, where you couldn't even, hold services, and definitely the financial worry. So multiple stress factors triggered some people even having suicidal thoughts.
So and I agree, because I think many of us can relate to that. You had relatives. I know a couple of relatives passed while they was in a nursing home, and we could not go see them. We could not go to the service, the funeral, and that's stress. That's stress. And also, the children were at home. Yes, at home. Well, that can be stress. That can be stress with the teenagers as well as the adults was, right? That's a whole different story. And there were husband and wife that would spend time together because of people working.
Yes.
Now you have all the dynamic, the personalities coming together. That is when I said, oh my goodness, what is this country coming to? I mean, I literally go to the grocery store. And when I leave the grocery store, this is a very serious topic, but I'm stressed because I can't find lemons with seeds, and I can't find an apple with a seed, and I can't find a watermelon with seeds. I'm stressed over the product that we are giving now, the produce that we are coming into the stores and doing. That's a whole different agricultural issue. But all these things are happening right now. I'm stressed with a political issue. That's a whole different story as well. That's a new one. You have to come back and talk with me in reference to that. So when people are diagnosed, how they are diagnosed, and we work and we know something going on, but how can we go to the doctor? We go to the doctor for our 5th annual checkup, and I think some offices are asking you questions now in reference to your mental state. So tell us a little bit about what can we do in reference to that.
Yes. So I often say that I'm a mental health educator, but I'm also an advocate. And so I say, when you go to the doctor's office, for whatever reason, we have to advocate for ourselves. When you think about it, many general practitioners have a time limit in which they can spend time with their patient. And it's usually maybe around 15 minutes. So it's in and out, if it's just a general checkup. Well, when you go in, if you know going in, I need to ask specific questions about my health, whether it's physical or mental, because mental health is health. Okay, but too often we separate them, but mental health is health. So if you know going in, to the doctor's office that you or a loved one might be having some mental health challenges, and maybe the doctor's only going to spend 15 minutes, I would say before they start asking all those questions, advocate for yourself up front.
Mm-hmm.
And that way they can adjust their time to spend with you, because a lot of doctors do not automatically ask the mental health questions. But if you go in ready to advocate for yourself, now, there may be some that don't know to advocate for themselves. And that's where the whole community piece comes in. If we feel like someone that we're close to or connected to may be struggling in some way with their mental health, then it would be good for us to have that conversation. So, for example, you mentioned that I'm a certified mental health first aider.
Mm-hmm.
A lot of people are familiar with CPR, right? CPR is basically someone who offers assistance until the trained professionals get there, life-saving assistance. A mental health first aider does the same thing. They offer a help when someone is experiencing a mental health crisis. So what I teach in those instructor classes is know some of the signs. You just mentioned stress. A lot of times stress shows up in the way we look, the way we act. Maybe we're more agitated. Maybe we snap at people a little more quickly than normal. Maybe we're fatigued, a little bit more than normal. Now, these don't automatically mean mental health challenges, but when we notice a change in someone's behavior and we're close to them, it's good to ask questions. If someone mentions the word suicide, sometimes it means that they are planning it. Sometimes it just means that they're just hopeless. So we have to be brave enough to even ask that person, are you having suicidal thoughts? Do you have a plan? Have you talked to anyone about it? If we notice them giving away things or seemingly saying goodbye just out of the blue, when we notice these things, that's when we want to advocate on their behalf and say, for example, Rev Sue, I've noticed that lately you've been more quiet, you've been more distant, you've been more isolated, and sometimes you seem a little more agitated. That's not like you. Is everything okay? And continue to probe you with questions to kind of pull that out of you. Sometimes people just don't know that they're having a mental health crisis. And so a mental health first aider can help equip someone with the skills, with the questions to ask, and with the ability to have boldness to say, I'm concerned and I think you might need professional help.
I remember years and years and years ago, and it was interesting that I was going through quite a bit, and I stopped like putting my makeup on. I stopped really just brushing my hair for 2 seconds and going to work, right? So I got whatever it was, I got out of it. And people came to me and said, well, you look so different now because I noticed that you didn't look the same. You didn't dress the same. I said, if you see me doing this, tell me about it. And that's good that you notice people because I get up at 5:30 in the morning and I'm fired up. So if my husband knows that I'm quiet at 5:30, 6 o'clock in the morning, he should definitely call you because there's something going on with me. Yes.
And that's important. And again, I want to emphasize it doesn't always mean it's a mental health crisis, but we have, as a community, we need to be more aware of the people we spend a lot of time with. Sure, I'm not going to notice that if I'm on the bus with someone or in line at the grocery store, but maybe people we regularly see at church or at work or at the gym or wherever we spend a good amount of our time, we really need to slow down enough and pay attention to the people around us. Because you were mentioning earlier, some statistics in terms of how many people are dealing with mental illness around the world. But
yes,
let's even break it down further when we talk about specific mental health disorders, for example, schizophrenia. NAMI has some statistics that says 1 in 100 American adults lives with schizophrenia. 6.1 million of American adults live with bipolar disorder. 16 million American adults live with major depression, and 42 million American adults live with anxiety disorders. So when you think about those are large numbers, most likely someone that we come in contact with on a regular basis falls into one of those categories that I just mentioned. And that's why we need to slow down enough and pay better attention to the people around us.
And again, you're saying that anxiety disorders or major depression and bipolar disorder. Yes, I read a while back that people do not. I mean, you can correct me when you're bipolar, because you sometimes you're changing different behavior, and people they get lonely because they don't keep their friends.
That is correct. And I will say, from personal experience, I have a family member who lives with bipolar disorder. And I will say, on a personal level, what disturbs me is when someone uses a phrase like, so and so is acting bipolar. That's really insensitive to a person that has bipolar disorder, because a person with the disorder may be what we call manic. They might be having an episode where they're just really high, but then in the next moment they can be really low and their moods just swing. And there may not be a trigger that you and I notice, but something within them has triggered something that causes them to, quote unquote, act out. I say they're having a bipolar episode. But people who don't understand that will reject, will walk away, will abandon folks because so and so acted wrong, came at me wrong, or as the young folks say, they talked to me, they were out of pocket, right? But a person who has bipolar disorder cannot manage that on their own. A lot of times they need medication, maybe therapy, maybe some kind of, neural examination. It all depends. I use this example. We say that people with autism are on the spectrum. In my years being in the mental health care field, I believe that people with depression are on a spectrum. It's not the same for everyone. Someone can have seasonal affective disorder, we call it, meaning when the seasons change, their mood changes. But it may not be a diagnosed mental health condition like bipolar disorder or schizophrenia or even anxiety disorder. Anxiety disorder is not the same as anxiety. They're related, but if someone has a disorder, that is characterized as a mental illness. But if someone is just dealing with anxiety or just dealing with depression, it's not always equivalent to mental illness. And I think that's where a lot of us also get confused. And that's why I'm adamant about educating people. There's a fine line. I can be anxious because I have an exam coming up, or I can be anxious because my paycheck hasn't come in and the water bill is due, right? But that doesn't mean I have an anxiety disorder. And again, that's something that's diagnosed by a trained professional. Does that make sense?
That makes a lot of sense, because also when you talk about bipolar again, is that some people not diagnosed until they like after 20 or 25 years old. Can you just a little bit about that? And
absolutely.
Yes.
Yes. Some people, it's been like 10 years. The family member that I was referring to did not get a proper diagnosis early on. And so we noticed changes in their behavior, but didn't really know to call it what it was. We found out later it was bipolar disorder, but that was because of consistent paying attention, where you just notice something is off a lot. So yes, it takes a long time for certain mental illnesses to be diagnosed. And that's why I go all the way back to advocating for ourselves, because some of us may be having a mental illness, but we don't know we have the mental illness.
Mental illness.
It's the same thing with physical. And I know this to be true for a lot of women, especially mothers, because we have so much to do. We know physically something's not right with us, but so many people are counting on us. So we just go, 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 go. And sometimes the same thing happens with our mental health. We know we feel off, but we don't stop long enough to figure out, why do I feel off? Like, this is really strange for me. We just keep going and going and going. And one of the blessings I feel that came out of COVID is it forced us all to slow down and stop. And I think we need to do more of that, so that people who need the help can get the help faster than 10 years.
That is so much. That is so mental health. I'm so glad you're here, because we really need to get a handle of this. It's just too many people we are around every day, so we can help them. So we can help. People can help us. We can help them. Going back to insurance coverage, let's talk about a little bit about that. As far as mental health, the insurance coverage, is it available?
Oh, this one, Reverend Sue, is the thing that I think aggravates me the most. It depends on the kind of insurance that individuals have. So the first thing I try to encourage people who feel like they might have some mental health challenges and they need some behavioral health assistance is immediately check with your insurance provider and see what the coverage is. If there is no coverage, then ask your healthcare provider, what are your other options? That's one thing. The second is you can contact an organization like NAMI, the National Alliance on Mental Illness, and they have resources available, not NAMI specifically, but they might be able to refer someone to resources where if insurance is sort of failing, if I can use that word, then maybe contact this organization or contact this hospital center, because there are resources out there. The family member that I was referring to, again, this person, because depression is I was going to say a diabetes, is a disability, excuse me. In fact, depression is the leading cause of disability worldwide, and it's a global contributor to a lot of disease that we have. And so this person was not able to keep a job. And without a job, this person did not have insurance. And so we had to help this person apply for Medicaid. And then through Medicaid, then we have to go down that whole rabbit trail of what do we need to do? Where do we go? Same thing with, dental insurance, a person who's unemployed. There are resources out there. It's just a matter of knowing where to look, asking the questions, and not giving up. It's about advocating for ourselves. So the last thing I'll say about why the insurance situation aggravates me so is because a lot of insurance companies also do not have equality between physical health and mental health. And so one of the things that NAMI does is we have Advocacy Day where we go to Annapolis and we talk with the politicians, the lawmakers about mental health, and we need more. We need more. And so that's another reason that I support NAMI and have done so since 2013 is because I know the work that they do for the community. And NAMI is funded by donations.
And so when you go to Annapolis, Maryland, the state of Maryland, and you go into the state to talk to officials. Okay. Yeah. Okay. I just want to clear that up so where people can also Google where is Annapolis. But anyway.
Oh, that's right. Thank you.
That's fine. That's fine. That's good. So I guess that we run out of time. The one thing I would like to really to ask you is this: is racism a model health issue or a social issue?
Ask me that again, please. Is racism what?
Is racism a mental health issue,
okay,
or a social issue?
So, yes. So let me answer it this way. Racism can be a risk factor for mental illness. I think there are contributors. There's risk factors. There's biological. There's psychological. There's familial, meaning family. There's cultural, and there's social. And so I think racism can fall into sort of that cultural, social piece. It could even fall into the familial, meaning the family, how someone is raised. And so I do think, yes, to some extent, racism or lack of understanding of different cultures and communities can play a part. So clearly, I'm African American, in case no one realized that. And one of the things I knew about growing up was we don't talk about depression. We didn't talk about mental illness. And if we talked about it, it was in the house and it stayed in the house. And so that stigma and shame still exists today. And then it's elevated within the Black church. And so one of the things I do as an ordained minister, part of my calling is I try to contact churches to invite me or have me in to either do workshops, trainings, or the mental health certification program, because we can limit some of these risk factors that I just mentioned. Barriers to getting help can include racism. It can include those stigmas and shame that come within a culture or a community.
Okay. To our church leaders, Reverend Stacy Smith, mental health, we have to do better. We have to do better. And the only way, I think, is we have to be educated to do better. So please, let's take this very serious. Because sometimes, even in our community, our children are small and mental health, we want to serve the community. God said love. And that means that we love people. We do not talk about them. We do not shame them. But we can do better by educating our congregants so that we can go to the doctor, like Reverend Smith said, and say, yes, this is a physical exam, but I want a mental exam as well. So you having a walk, we have 2 minutes, but 1 minute. You having a walk real soon. Tell us a little bit about that and how can we contribute to your fundraiser?
Yes. So every year, NAMI does what's called a NAMI walks, where we walk to raise funds. And so people don't have to necessarily walk, but they can donate. And I do have a website where people can donate to the annual NAMI walks. We will actually be walking. We have one walk in May and one walk in June, because I participate with NAMI in 2 different counties. So if people are interested in donating, the website is too long to say online. And so this fundraising effort helps contribute to the resources and support that NAMI offers year round.
Okay. Thank you so much. And taking the time to be with us. And again, to our listeners, thank you so much for tuning in to Sunday Evening with Rev Sue. We appreciate you. So if you're on YouTube, please subscribe and like. And we thank you for such a serious topic that tearing our family apart. And we have the information, we have the help, we have the doctors, we have people to help. So we have to make sure that we be educated to mental health. May God bless you, and you've been listening to Sunday Evening with Rev Sue, and have a great week.